Okay, guys, so I do not have access today to the directly overhead projector, so we're gonna try it like this. I will try to get access to one of those overhead ones to do this on future strips, but for right now, we're gonna make this work. Hopefully, it will be better than nothing. Okay. I gave you guys the answers to this. I'm not going to do this PVC because I know it confused a lot of people with it having a PVC in it. So I'm going to skip ahead and I'm going to do the first 10 strips. So the ones that you were given for your assignment for module 1, and we're going to go from there. So first thing I want to do is I want to apologize because some of these strips, I told you they were all going to be 6 seconds, and I realized afterwards that some of them were not. So I'm going to show you how to check to make sure they're 6 seconds. And I will do better in the future to kind of call out the ones that are not 6 seconds to make sure you know to pay attention to that. So first, if you see these little dots or arrows up at the top, that is 1 second or 5 big boxes. So here we have 1, 2, 3, 4, 5, 6. So this is a 6-second strip, which means you can go about counting it like normal and multiplying it by 10. Okay, so the first thing I want to look at is the rhythm. Does it look regular or irregular across the page? This looks regular. Okay, I'm just going to put R for the sake of time. I am going to skip this for right now, and I'm going to go to this next section here. So the next I'm going to look at is P waves. All it's asking for when I say P waves is, are they there and do they look normal? So yes, they're present. I'm going to put P and they look pretty normal. So I'm going to put just P in it. Okay. To calculate my atrial rate, all I have to do is calculate my P waves. Now, I am literally going to go through and put a dot on every single P wave. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I have a atrial rate of 12 in a 6-second strip, which means my atrial rate is going to be 120. I'm going to do the same thing for my ventricular rate, which I'm going to count my QRS complexes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So same, I have a ventricular rate of 120. Those match, so that is my heart rate. Okay, if those don't match, we are going to go with the ventricular rate for our heart rate. Okay, so it looks pretty normal to me. Right now it's looking like sinus tach. So now I'm going to go for the PR interval. I am going to find a P wave that starts as close to a line as I possibly can. Okay, so like, let's find this one basically starts here on this line. Okay, so then I'm going to go to where it ends here. That right there, that little box, that is 4 small boxes. So that's going to be, sorry, 0.16 because it's 4 small boxes. Okay. Then my QRS goes from that point to here. Okay. So again, that's going to go just where it gets back on the baseline strip. So you're going to calculate it. That is 1, 2, 3. 1. So I'm going to say that's about 0.12. Okay. There are probably going to be other ones where you think it might be 4. Okay. There might be one where you think it's 3.5. I'm going to give you some wiggle room. Okay. So I don't want you to stress about that. The QT interval, like I said in the module 2 video, I'm not all that concerned about this because your QT interval changes with every heartbeat. It's going to vary just a smidge. And so I just want you to do the best you can here. It's not going to be perfect, okay? But I'm going to start at the same spot that I started my QRS interval with. So over on this point right here. And then I'm going to go all the way to the end of the T wave, which is going to be about here. Okay. So when I'm doing this, then whenever I can count a big box, that's what I want to do. Okay. So like this whole big box is within that. So I'm going to do that. That's 0.2. Then I know that there's one small box on the other side of this. That's 0.24. And then there are 1, 2 small boxes on the other side. So that's going to be 0.32. Okay. So all of these look pretty normal except for the rate. So I'm going to call this one sinus tach. And then what am I going to do about it? Well, it depends on what's going at on the patient. So you're going to look at your patient's signs and symptoms. Okay, are they symptomatic? Do they have pain? Do they have a fever? Do they have anxiety? Okay. Really the only treatment for this probably is going to be IV fluids. But honestly, probably you're not going to do a whole lot of anything. You might give an antipyretic if they have a fever or an anti-anxiety, if that's the cause. But we're going to look at the signs and symptoms and we're going to treat the cause of the fever or of the tachycardia, not the tachycardia itself. Okay, so that's the first one. So let's do the second one. So again, I'm going to make sure this is a 6-second strip. There's lines at the top, 2, 3, 4, 5, 6. So this is a 6-second strip. Again, I'm going to look at it. Oh, it looks pretty regular, okay? Okay. How do my P waves look? They look pretty normal, so they're present and normal. Let's count my P waves. 1, 2, 3, 4, 5, 6, 7, 8. So my atrial rate is 80. Let's count my QRSs. 1, 2, 3, 4, 5, 6, 7, 8. So I also have a ventricular rate of 80, which means my heart rate is 80. Okay. Everything's looking pretty normal so far. So let's find a P wave that starts on a line. This one is really hard to see on the actual paper itself. So I would maybe pull this one up on your tablet or on your laptop. But if I find a P wave here, it goes to here. That is going to be 3 small boxes, so that's going to be 0.12. My QRS is going to go from that same there to here. That's another 3 boxes, so that's going to be 0.12. And then my QT interval is going to start here and end like here. So that is basically just one shy of 2 big boxes. So that's going to be 0.36. Okay, interpretation of this is just going to be normal sinus rhythm. And I don't have any treatment of that because it's normal. Okay. All right, let's look at the next one here. So next I'm going to look at is it regular across the page? So my rhythm is regular. Okay. I have P waves for every QRS, so they're present and normal. Okay. I'm going to see if it's a 6-second strip. 1, 2, 3, 4, 5, 6. So it is. Now I'm going to count my P waves. 1, 2, 3, 4. So that's going to be an atrial rate of 40. Then I'm going to count my QRSs. 1, 2, 3, 4. That's going to be a ventricular rate of 40. So my heart rate is going to be 40. Okay. This one, the boxes are hopefully a little bit more clear to see. So I'm going to start, my P wave starts here and ends about, call it like this one right here. So that's going to be 1 box shy, 1 small box shy of a big box. So that's 0.16. My QRS starts pretty much on that line and goes here. It's pretty narrow. It's like 2 small boxes. So 0.08. My T wave is all the way out here. So it's going to be all the way to here. So let's look at that's 1, 2 full block boxes. Plus, I'm going to call that like 2 small boxes. So I'm going to call that 0.44. Okay. Again, I'm not super concerned about the QT interval. I don't want you to focus on that. Okay. So my interpretation of this one is going to be sinus bradycardia. Okay. What am I going to do about this? Well, it depends. I'm going to look at my patient's signs and symptoms. Are they having any? Are they an athlete? Is this normal for them? So is this their baseline? Is this their normal? The only treatment really we might do is atropine, if they are symptomatic. So if they had a syncopal episode or something like that. Okay, so that is number 3. Number 4, let's look at it. Okay, first 1, 2, 3, 4, 5, 6. So that is a 6-second strip. So it looks pretty regular to me. And it looks like there is a P wave and they're normal. So it's going to be their present and normal. Okay, now I'm going to count my P waves. 1, 2, 3, 4, 5, 6. So an atrial rate of 60. I'm going to count my QRSs. 1, 2, 3, 4, 5, 6. I have a ventricular rate of 60, so I have a heart rate of 60. This is looking pretty normal for me right now. I'm going to go find a P wave that starts on a line. Okay, this one here. So that's going to be 1, 2, 3, 4, 5. So that's going to be 0.2. Okay, my QRS from there to here, that is 3 small boxes, so 0.12. And my QT is going to come all the way out to this line. Let's look at the big boxes because that's easier. 2 big boxes plus 2, 1, no, 2 small boxes. So 0.48. Okay. You guys see how I'm second guessing myself and questioning it? So it's okay that you guys are doing this because I've been doing this a while. You have not been doing this a while. So it's okay if you're questioning yourself. You're not going to be perfect. I'm giving you some leeway. Okay. In the real world, when you do this, it is going to calculate it for you on the EKG or on the monitor. So really, it's more important that you can interpret what you're seeing here. All of these numbers are normal. My rate's normal, so this is just normal sinus rhythm. And I don't have any treatment for that because it is normal. Okay. All right, so let's look at 5. So I've got a 1, 2, 3, 4, 5, 6. So this is not a 6-second strip, and you can kind of tell because it's zoomed out a little bit. So you're gonna stop here. And you're not going to look at this section over here because that's not part of our 6-second strip. So I apologize. I took this class over from somebody and I'm using an old packet and I didn't realize they had strips in here that were not 6 seconds. So just make sure that you're only doing 6 seconds. Okay. So we're not going to look at this. Let's start here. It looks pretty normal or regular, excuse me. I have P waves and they're upright and they look normal, so they're present and normal. I'm going to count my atrial rate 1, 2, 3, 4, 5. So that is an atrial rate of 50. Then my ventricular rate 1, 2, 3, 4, 5, 50. So my heart rate is 50. So just a little bit slow. I'm going to go on here and try and find a P wave that starts on a line. This one does. So that is going to be 1, 2, 3 small boxes, so 0.12. My QRS is going to be 1, 2, 3, 3 small boxes, so that is also 0.12. Then my T wave ends all the way out here. So that's going to be 1 full box plus 4 small boxes. So, and then plus 2 small boxes. So I'm looking at so 2.36, basically 0.40, right? 44. Okay. All right. So what is this? This is just sinus brady. Okay. You can look back at the other one that we looked at for sinus bradycardia. You're going to look for their signs and symptoms. Is this normal for them or baseline? If any medications are needed, it's probably going to be atropine. Okay. So now this one, I know there was a lot of confusion about why this was regular, but it is regular, and that is because this is called a sinus pause, okay? This is not a heart block. We have not talked about heart blocks yet, so I don't want you to get that vocabulary in your head yet. This is a sinus pause, okay? And a little bit more information is like a sinus pause is going to be less than 3 seconds, and the R to R is going to be equal, and it's like a multiple of that. So it's going to be 2 R to R or 3 R to R, something like that. Versus a sinus arrest is longer than 3 seconds. And we don't have a R to R that is going to be equal to a full number. So it's not going to be a multiple. It's not going to be 2 R to R or 3 R to R. It might be like 1.5 R to R. Basically, it just starts back up kind of randomly. So when you're looking at it, you can kind of tell I have, first of all, 1, 3, 4. So I actually have a little bit too big of a strip here as well. Wait, no. 1, 2, 3, 4, 5. Here's the second. Ignore these small lines, y'all. 3, 4, 5. This is actually too small of a strip, so that's not a great example either, but we're gonna pretend it's 6 seconds, okay? Um, so my P waves are present and they're normal. Again, this is not even a full 6-second strip, so we're just gonna pretend that it is, for the sake of time. I need to go back and fix this. So the atrial rate, the P waves, 1, 2, 3, 4. I'm gonna say that's 40. Okay, then I have my QRS 1, 2, 3, 4. My ventricular rate is 40, so my heart rate is 40. Okay, now let's look at a good PR interval. So this PR interval, it starts on the line and ends on the line. So my PR interval is 0.2. My QRS goes until about here. So that's going to be 2 small boxes or 0.08. And then my QT interval goes all the way to here. So that is going to be 1 small box short of 2 big boxes. So that's going to be 0.36. Again, whenever I can count big boxes, that's easier. So I have 0.2, and then I have another 0.2 minus the 0.04 of 1 small box. That's just easier to calculate than counting 9 small boxes, but whatever works for you. So this is just a sinus Brady plus a sinus pause. Okay, so you always have to diagnose the underlying rhythm here, which is sinus bradycardia, but then you have the pause right here. And again, that's just because when you're looking, here's my R to R, right down here. Well, if I draw that again here, here, and then it picks up being normal after that. So we have this one missing and this one missing. So it's 2 R to R's, and then it goes back to normal. It catches up back on its baseline. Okay, my lines are not perfectly drawn because I didn't use a ruler or anything, but an approximation is good enough. Okay, so here what we're going to look at is the patient symptomatic? Okay, atropine may work on this for the underlying sinus bradycardia. It may not. So we're going to look at their signs and symptoms, and we're going to go from there. Usually it's kind of benign. Okay, so let's look at this one. In this one, you can kind of see that all of these are not equidistant apart. So this is actually an irregular rhythm, especially over here. You can see really well that those are too close together compared to the rest of the strip. Okay, again, let's make sure I have a 6-second strip, which I do. 6, okay. I do have P waves, so they're present and they look normal, okay. Let's count my P waves. 1, 2, 3, 4, 5, 6, 7, 8, 9. So I'm going to have an atrial rate of 90. My QRS is 1, 2, 3, 4, 5, 6, 7, 8, 90. So my heart rate is 90. Okay, let's look at my PR interval. This one looks like it starts right about on this line and goes to 1 line short. So that's going to be 1 small box short of a big box. So that's 0.16. Then my QRS goes to about here. So that's 1 plus 3, a total of 2, actually. So a total of 3 small boxes, so 0.12. And then my QT interval goes all the way to almost this big box. So that's going to be like 1, 2 big boxes plus 1 small box is 0.44. Okay. Again, I do not want you stressing about exactness on these numbers because depending on which complex you pick, these numbers are going to vary slightly. Okay, so if you picked this one, you're probably going to get a little bit different numbers than if you picked this one than me picking this one. Okay, so please don't stress about that. I promise you I am not going to be that specific. I just really want you to kind of understand what's going on. So we have a normal rate and we have normal intervals. The only irregularity is that this is an irregular rhythm. So this is sinus arrhyth. Oh, man, y'all, I can't spell this word. Rhythmia. See, I still spelled it wrong. Sinus arrhythmia. Okay. Usually this is benign and we're not going to have any treatment for that. Okay. So you can kind of tell right off the bat, this one looks smaller, so it's probably not a 6-second strip. So 1, 2, 3, 4, 5, 6. Again, you can kind of see the lines that stick up right there. That's the second marker. So 1, 2, 3, 4, 5, 6. So this is the end of my strip. I'm not going to look at this last 2 seconds. Okay. All right, my rhythm looks pretty regular. My P waves look pretty normal, so they're present and normal. Let's count my atrial rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Okay, so my atrial rate is 120. Ventricular rate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. My ventricular rate is also 120, so I have a heart rate of 120. This is already seeming like it's sinus tachycardia, right? But let's check everything to make sure. So this P wave looks like it starts on that box and ends about here, 3 lines in, so that's going to be 0.12. My QRS is very narrow. It's 2 small boxes, so 0.08. And then my T wave goes all the way past 1 line into the next big box. So it's 1 big box plus 1 small box on this side, 2 small boxes on this side. So that's going to be 0.32. So 0.2 plus 0.04 plus 0.08 is 0.32. What is this? This is just sinus tach. We're going to look back at signs and symptoms, right? Anxiety, pain, fever. We're probably going to treat with IV fluids or fever reducer. Okay. All right. Last 2. Hopefully this is helpful. I apologize again for the angle. I'm trying my best here. Okay. So let's count to make sure it's 6 seconds. 1, 2, 3, 4, 5, 6. Okay, it is. My rhythm looks pretty regular here. Okay, regular. My P waves look pretty present and normal. Okay, let's count my atrial rate. 1, 2, 3, 4, 5, 6, 7, 8. Okay, my atrial rate is 80. Let's count my QRS as 1, 2, 3, 4, 5, 6, 7, 8. My ventricular rate is 80. My heart rate is 80. That seems pretty normal to me. Okay. This one again is really hard to see on the paper, so you might want to do this one on a computer. So let's see this one. Let's start it here to here. To me, that looks like 3 small boxes, so that's going to be 0.12. My QRS is also small. To me, that also that just looks like 2 small boxes to me, so 0.08. And then my T goes all the way out here to big box. So that's pretty easy because we've got 2 big boxes for our QT. That's 0.4. Okay. All of that looks normal. This is normal sinus rhythm. We have no treatment for that. Okay, finally, we have this, which looks, at first glance, you think that looks irregular, and then you notice, well, there's this big gap here, so let me try and see if these are all approximately the same distance apart, which they are. So we really only missed 1 beat here, right? There's this R to R, this R to R are the same. So this is just going to be a pause, just like we had before. Okay, so let's look at how long the strip is. Okay, 1 second, 2 seconds, 3 seconds, 4 seconds, 5 seconds, 6 seconds. Okay, so we've got a 6-second strip. It is regular. I have present and upright P waves, so present and normal. Now let's count them. 1, 2, 3, 4, 5, 6. So that's 60. My ventricular rate, 1, 2, 3, 4, 5, 6, that's 60, so my heart rate is 60. Let's look at my PR interval. This one starts right here on the line and goes to here. That is about 3, so I'm going to call that 0.12. And this is, looks like 2 small boxes to me, so I'm going to call that 0.08. I could also make a case for like a half box, which would be 0.1, because it would be 2.5 boxes. But again, please don't stress yourselves out about that. And then my T wave is really kind of difficult to see, but it's going to end like right here. Okay, so that's going to be 1 big box plus 3 plus 1. So 0.36, because it's 0.2 plus 0.12 plus 0.04. It's going to give you 0.36. So this is normal sinus rhythm with a sinus pause. Okay. This one you're probably not going to do anything about. You're just going to wait and watch. Okay, so that is the first 10 strips. Hopefully that was helpful. If you have any additional questions that you have for me, please let me know. Otherwise, good luck on the second module.